Thank you so much for joining us today with our GLP-1 webinar. Let me introduce ourselves really quickly here. I'm Dr. Tiffany Pham. I am a board-certified OBGYN and the medical director here at Allara. And this is Dr. Sonia Gibson. So, Dr. Gibson, if you want to go ahead and quickly intro yourself, and then I'll take over.
Yes, sure. Hi, everybody. Welcome. My name is Dr. Gibson. I'm the endocrinology lead here in Allara. A little background about myself. I have 15 years of experience practicing endocrinology. 12 of those were in a hospital-based system, and I decided to try something different and joined the health tech space 4 years ago. And I joined Allara, and I've been with Allara ever since and very, very happy to be here. Dr. Pham?
Thank you. Again, I am a board certified OBGYN. I actually started my career in medical education, training like medical students, residents, and like young attending physicians, and then subsequently actually pivoted into the health tech space as well. I was the US medical advisor for a UK-based like period tracking app called Flow, and at Flow, I worked on creating just educational content for people with varying levels of health literacy, basically. So I worked on socials, journalistic pieces like blogs and articles, things like that. And now I am currently serving as the medical director at Alara, and I am leading our like virtual healthcare delivery team on this platform here, which really provides like high quality, accessible care for patients. So that's quick intro about us. We can definitely dive into the topic of the day. I know all of you guys are super excited to talk about GLP-1s just because there's a lot of buzz about these medications. And the big question is always kind of, what are they good for? Like, do you have to be on them for a very long period of time? So I'm so glad that you guys are here and all of the questions you submitted are really insightful, really great. We're going to definitely dive deep into them for you today. But first, let's kind of start off with just some brief education around what GLP-1s actually are. And then we'll get into your questions. Okay. All right. So quickly here for our agenda, we'll talk about GLP-1s. We'll talk about what type of support you need to be on when you're taking GLP-1s to really ensure your long-term success. We will cover your questions, and I also want to leave some time at the end for an open Q&A, just so we can make sure that we're covering everything that you guys have questions about. All right. So Dr. Gibson, can you take it away here?
Sure. So, what are GLP-1s? GLP-1 stands for glucagon-like peptides. They're natural peptides that your body produces. GLP-1s have been around for a while now, early 2000s, but we have like newer versions that are more effective and have less side effects, are more tolerable. But we've been using GLP-1s for quite a while now, so they're not new. How do GLP-1s work? The main actions for GLP-1s when we talk about weight loss is via appetite suppression, satiety promotion, and it also can help glucose control. So even though they were initially developed for diabetes management, type 2 diabetes management, we now have an FDA approved label for weight management. Next slide. So what are the available FDA approved GLP-1s? So we divide it into categories: GLP-1s that are used for weight loss purposes, obesity management, and the other ones are used for type 2 diabetes management. So for weight loss, we have Wegovy, Zepbound, and Saxenda. And for diabetes, we use Ozempic, Mounjaro, Trulicity, and Victoza. This is important because when we're using insurance, we really need to determine which type of GLP-1 we would be using for what specific medical condition. So GLP-1s are typically the injectables, are the ones that are more available or more commonly used, and they can be injected weekly or daily, depending on the GLP-1 preparation. But we now have the oral version, oral Wegovy. So they're highly effective. Wegovy has approximately 10 to 17% body weight loss. Zepbound is higher. It can go up to 21% body weight loss. Saxenda is one of our oldest GLP-1s for weight loss. It's only about 5 to 8% weight loss, but still all of these preparations are highly effective for weight loss. So let's talk a little bit about oral Wegovy. So it's the first oral GLP-1 that was recently approved by the FDA this year, January of 2026. So the administration, of course, is oral, but it has to be taken daily, 30 minutes before you have breakfast. It's very significant because it's the only oral GLP-1 um, medication that we have to treat for obesity. We have one that's for treatment of type 2 diabetes called Rybelsus, but this medication, the way it has been formulated, is much more effective for weight management than Rybelsus is. In trials, Wegovy, oral Wegovy and injectable Wegovy are very similar as far as their effectiveness for weight loss. And we have several doses that escalate depending on the patient's tolerability and their weight loss results. Next slide. And so what are the main differences between oral Wegovy and injectable Wegovy? So as I mentioned before, oral Wegovy has to be taken on a daily basis versus the injectable Wegovy, which is done in a weekly basis. Oral Wegovy tends to be more convenient for frequent travelers because you don't need needles and you don't need refrigeration. The side effects are the same, very similar: nausea, constipation, overall GI upset. These side effects tend to be mild and transient, which means initially you'll probably experience the side effects, but it's nothing that would really impact your daily life. And as you continue using this medication, your body gets used to them. There are some patients that respond much. Everybody's different. So some patients do have some trouble tolerating this medication, but in general, the side effects tend to be mild and short-lived. As far as out-of-pocket cost, oral Wegovy is cheaper than injectable Wegovy. Depending on the dose, it can go up to $299 a month versus the injection, it can go over $349 per month. And the weight loss benefits, like I mentioned, they're very similar, anywhere from 13 to 17% with oral Wegovy and 15 to 17% with injectable Wegovy, depending on the study and the duration of treatment.
Okay. I am going to cover, GLP-1s for hormonal and metabolic health really quickly. And to start, what I want to talk about is the stigma around weight management medications like these GLP-1s, right? Oftentimes people think, oh, if you go on the medication, all you're doing is taking it and then you're magically losing all of this weight. And that's not actually completely true. Yes, these medications help with weight loss. However, to really get the best outcomes, to really get really the outcomes that you're typically looking for, that 15 to 20% total body weight loss, it really is embedded in the foundation of weight management, which is always nutrition and lifestyle. This is where I do think Allara stands out a little bit amongst everyone else who is managing GLP-1s, because we approach weight management from a very multidisciplinary approach. And what does that mean? Obviously, you have your medical provider who is prescribing the medication for you and adjusting the dose as needed and trying to help you reach those goals. On the other hand, you're working with a dietitian, which they are really, really crucial in how successful you will be with this medication because, one, they can help you manage the side effects that often come with these medications. They help you build that foundation around what are your nutritional habits going to be long term to help sustain weight loss. It's losing weight is hard, yes, but sustaining weight loss is so much harder if you don't have these foundational habits in place. And when we talk about lifestyle, what are our dietitians really talking about? They're trying to understand, what does your movement look like? What does your sleep look like? What about stress? Stress and all of these things really can play a role in how well your body is able to maintain weight loss over time. So kind of that big idea here is when you are utilizing these medications, you will by far have better outcomes if you can combine it with some approach grounded in nutrition management and lifestyle management. So let's talk a little bit about GLP-1s and of course the whole aspect around hormonal and metabolic health, and how do GLP-1s really play a role in these types of conditions. So conditions like PCOS or perimenopause or menopause, these are all hormonal conditions that can cause you to maybe gain weight a little bit more easily or make it a little bit harder to lose weight. And why is that? Some of these conditions, the underlying problem is insulin resistance. Insulin resistance is essentially a condition where your body is not utilizing insulin very well. What is insulin? It's actually a hormone. Insulin is a hormone that essentially allows your body to metabolize and use glucose, right? In a better manner. So if you are insulin resistant, meaning your body's not as sensitive and not responding to this hormone very well, you are essentially going to have very uncontrolled glucose levels, which then kind of down the line can lead you to developing a little bit more weight gain or making it a little bit harder for your body to lose weight, right? So these hormonal conditions are rooted in, to some degree, insulin resistance, and GLPs can help with insulin resistance, which is why in some of these hormonal conditions, GLPs can really be what I would call like a great leveler. So what do I mean by that? It can level the playing field for you if you have certain hormonal conditions that make it harder to lose weight or easier to gain weight. So the analogy I like to use for patients is, if I tell you to run an obstacle course, but if I tell you, hey, I want you to run that obstacle course with one hand tied behind your back, that's not going to be very fun, obviously. And having these hormonal conditions is like running an obstacle course with one hand tied behind your back. But then when you use GLPs as a part of the tools, or maybe, one of the tools that help you with weight management here, it's like all of a sudden saying, okay, now I'll actually let you use both hands as you're running this obstacle course. So always think of these medications as a leveler, and it will level the playing field in certain hormonal conditions that are kind of driven underlying by insulin resistance. Now, obviously, we all know about the weight loss that can be associated with these medications. And the other side of GLPs is really less talked about, but I wanted to highlight this here for you guys because other than weight loss, there are other things that can be really that you can benefit from by being on these medications. So in PCOS, if you are on a GLP and you're doing well, you're managing your weight, you're reducing your insulin resistance, it can actually help you regulate your periods. And oftentimes people who have PCOS struggle so much with the period regulation aspect and some of the hormonal problems that down the line stem from the hormonal dysfunction present in PCOS. From a fertility standpoint, if your fertility is affected because you maybe have a higher BMI, that can affect your ability to get pregnant. Or if your fertility or your infertility, if you will, is due to having a condition like PCOS or some conditions that are preventing you from ovulating, weight loss and the use of GLP-1s can actually help improve those parameters there. Improving insulin resistance, we kind of covered that already, so I don't want to dive into this too deeply. But the last point I want to make here is reduction of inflammation. This is actually a little bit newer in terms of the data that we have around reducing inflammation with GLPs. So what we're actually seeing is that GLPs, they are blocking certain inflammatory pathways, thereby reducing certain inflammatory biomarkers, right? So what does all of that jargon mean when we look at it from a clinical standpoint? So we've looked at specific conditions like cardiovascular disease, chronic kidney disease, fatty liver disease. All of these conditions are rooted in some way, in some form or fashion, in inflammation. And when patients are on GLPs, what we've seen in the research is that regardless of how much weight they lose, being on a GLP actually improves the outcomes of these conditions. And that's likely due to the underlying reduction in inflammation that you get from being on these GLPs. Some of the other conditions that we're starting to study, neurodegenerative diseases, autoimmune conditions that are rooted in inflammation, like psoriasis or rheumatoid arthritis as well. So this is a really exciting, I would say, field that we're looking and utilizing GLPs for. So I'm actually really interested to see in the next couple of years what other conditions we can actually use GLPs for from an inflammatory standpoint rather than just weight management. Okay, so I will let Dr. Gibson handle this question here.
Sure. Okay, so we'll start with some questions that were submitted prior to this webinar. We had several questions. We tried to kind of combine them based on the topics. And one of the questions was that came up a lot is how would GLPs affect hormonal conditions like PCOS? So as Dr. Pham mentioned, It's there's this very strong link between insulin resistance and PCOS. So what happens with insulin resistance? Your cells are not responsive to the insulin action. There's something wrong with the receptor. So the pancreas is going to just continue to secrete more insulin to try to overcome that resistance. And insulin is an inflammatory anabolic hormone. So it makes you gain weight. It makes you store fat, store energy. And this is particularly relevant in PCOS when we talk about ovaries and how ovaries respond to insulin. When there's insulin resistance at the level of the ovaries will start secreting more androgen levels, so testosterone, DHEA sulfate. As these androgen levels start creeping up, there's going to be a dysfunction in your normal menstrual cycle. So the pituitary and the ovaries, the way they communicate is going to be disrupted. So patients can go from anywhere from having irregular periods, skipping lots of months without a cycle, to complete amenorrhea, which means no periods, and ovulatory dysfunction. So when we give GLP to patients with PCOS, and we have been doing this, like I mentioned before, for quite some time because we know the benefits of it, as we decrease that insulin resistance, as we sensitize those cells, specifically at the ovaries, obviously, pretty much every cell can be responsive to GLPs, but specifically in PCOS, we're talking about the ovaries. As the ovaries start getting more sensitized to insulin, there's maturation of these follicles, and there's potentially the ovulatory cycles start resuming, and that's one of the ways that it can improve fertility. So this is really the main action of how GLP-1s help with PCOS and restoration of ovulatory menstrual cycles.
All right. Okay, so moving on to the next question here. How do GLPs affect conditions like endometriosis and thyroid health? And I think this is a great question to bring up because one, endometriosis is rooted in inflammation. And I just went on a whole spiel about how, these medications help things rooted in inflammation. But the reality is that we actually haven't studied endometriosis yet in the setting of using GLPs. So it's really important to understand that even though we have an understanding of how GLPs can reduce inflammation, if we don't have the data or the clinical trials to support the use of GLPs with these conditions, it's hard to come up with a conclusion as to whether will it be effective in a condition like endometriosis. Theoretically, it should be. But some of the questions what we're probably asking is, well, if we start a GLP in a patient with endometriosis, how does it improve their disease burden? Does that mean they have better pain improvement? Does it mean that it will prevent the endometriosis from progressing? Does it decrease the burden of disease so you don't necessarily need surgery? We don't have any answers to that quite yet. Hopefully in the future, this is studied, but for right now, uh, in reference to endometriosis itself, we just don't have the clinical data. Thyroid health, specifically autoimmune thyroid conditions like Hashimoto's or hypothyroidism or hyperthyroidism, we actually do have some research into looking at whether GLPs affect these thyroid conditions overall. And what's interesting is that we don't really see a positive or negative benefit. Like it actually doesn't change the course of these conditions as far as we can tell. So basically, what do I mean by that? When we look at the use of GLPs with these thyroid issues, we don't really see if it helps to improve the thyroid health. We don't really see if it, prevents you from progressing into hypothyroidism if you have Hashimoto's. So the data isn't super clear cut on these two conditions at the moment. Hopefully in the future, we'll have more and we can give you a better update and more information on this. All right, long-term treatment for GLPs. Will I need to take it for forever? This is such a common question that I get all the time when patients are placed on these medications. And so, honestly, the answer is very individualized, to be quite honest. And the reason why I was harping a lot on nutrition and lifestyle as a foundation is because when you are on GLPs, it's so important that you build these habits into place so that you have the possibility of weaning off and coming off of these medications. Because when you're on GLPs, it makes it a little bit easier to build these habits, right? And then when you want to come off these medications, if you have the nutritional foundation, if you have the lifestyle foundation in place, it is feasible to come off of these medications and not regain all of the weight back. What does the current research show? Currently, we see that about 80 to almost 90% of people who come off these medications may regain some weight. Some will regain a little bit, some will regain all of their weight back. Honestly, that has to do a lot with, how are they managing that long-term weight management through some of the habits that they've learned, hopefully, when they were on the GLPs. Some people actually get the reduction in food noise when it comes to being on these GLPs, and that is really beneficial for them long term. Now, that said, I think it's really hard to hear that, oh, yes, you'll be on a long-term medication for the rest of your life. I completely understand that. But what we need to think about is if we're treating weight in the grand scheme of like treating obesity, obesity is a chronic disease. Most people don't really bat an eyelash when you have to be on medication for high blood pressure or cholesterol. But I think the stigma around weight medications makes this question so much harder to answer. And the other thing to honestly think about when it comes to like weight regain in this group as well is there are ways that you can manage GLPs when you're in a maintenance phase. So you're not always having to take an injection on a very regular basis. And a lot of that individualized approach comes down to how you're managing it with your provider. So it's a really good idea to make sure that you have a team that is pretty well educated around this and kind of give you options as to like, hey, if I want to taper, how do I do that? Do I then switch myself to other medications? Will I be able to come off of this long term? And if I don't want to come off of it long term, how do I manage my maintenance when I get to that phase? So again, find a care team that works for you to kind of help answer some of these questions. But the short answer here is it's very individualized. Okay, do GLPs help with infertility? I will take this one
I
as
think
well.
I think you missed one slide,
Oh, I
right?
missed one. Okay, there you go. Sorry about that.
Yeah, yeah, yeah. Okay. Yeah, no worries. Okay, one of the questions, actually several questions about what is a peptide and what does it do versus a GLP-1? So like I guess the difference between peptides and GLP-1. So peptide, think of peptides as tiny proteins in your body. They're amino acid chains, and they have a specific function for a cellular activity. Some peptides need tell a cell to do this, and some peptides to tell a cell to do that. So we have many, many peptides in our body. One of them being a GLP, glucagon-like peptide. So GLP-1s are released from the gut. They have many physiological effects on the body, and the brain, the heart, the liver, the muscle, ovaries, you name it. A lot of functions specifically from the GLP-1s. So there are other peptides that are sold and given to patients mostly for like anti-aging and stuff like that, but they're not the same peptide as GLP-1s. They're completely different. We have a lot of studies regarding GLP-1, multiple studies, years and years of data of GLP-1. We don't have enough data about other peptides that are being used. They're not extensively studied as GLP-1s. So that really is the main difference. They're just different. They have different cellular activities.
Okay. Now on to infertility and GLP-1. So I will take this one from Dr. Gibson. The short answer here is you cannot be using a GLP if you are trying to get pregnant or if you are pregnant. So no, you can't be on these medications when you're pregnant or trying to get pregnant. Now, can you be on these medications before you try to conceive? Yes. And I do think this is an important distinction to make because, particularly in patients who struggle with infertility, because their infertility is driven by what we call anovulatory cycles, meaning they're not ovulating, perhaps because their BMI is too high, and that's driving the underlying issue there then with weight loss, it can actually help improve your chances of getting pregnant. Having a lower BMI or as normalized of a BMI as possible before you become pregnant is also super important to think about because we have to think about pregnancy outcomes as well. And what we find that in pregnancy, the higher your BMI, the higher the risk your pregnancy will be, meaning you might develop diabetes during pregnancy, high blood pressure. You might be at higher risk for C-section or failed inductions and things like that. So At the end of the day, when patients start thinking about trying to conceive or their fertility overall, and let's say that their BMI is a little bit on the higher side, the way that I like to think about this with patients is, hey, what's your timeline? How long do we have to optimize your health, your BMI, your metabolic health, and get you to that healthier place so that you can get pregnant, and that you don't have these barriers? And hopefully, like from an ovulation standpoint, I just want to give like some context and background so people understand what I'm talking about when I'm talking about ovulation. So obviously, ovulation is when your ovary is going to release an egg, and that egg obviously can be fertilized. That's how you get pregnant. Now, imagine if you have normal menstrual cycles and normal ovulation, you're doing that about 12 times a year, once a month, right? When you don't ovulate very well, because maybe your BMI is high, you have insulin resistance, you have underlying conditions like PCOS, you're not ovulating as commonly. So maybe you will ovulate 8 times a year. So you can see, obviously, between 8 versus 12, you're going to have a higher chance of getting pregnant if you're ovulating more regularly versus when you have something that's interfering with that ovulation. So, from a GLP standpoint, it can help really normalize some of these conditions to help improve your ability to get pregnant. But once you're ready to start trying, we usually tell patients you need to come off of this medication for about 2 months before you start actively trying to get pregnant. If you accidentally get pregnant on these medications, quote unquote, you have an Ozempic baby. This is kind of where, all of those news lines come from because people are losing weight, they're ovulating more, and now they're getting pregnant. You have to come off of the medication immediately. Now, that said, this is why it's also important to have those foundational nutrition and lifestyle habits in place as you're tapering off of these medications to become pregnant, because we want you to try to maintain that healthier version of yourself, that healthier BMI as much as you can as you're going into pregnancy, right? Okay. And I think I have another question here on microdosing. I'll let Dr. Gibson take this one.
Yeah, so microdosing in the question is what is microdosing and is it effective? There's a lot of chatter about what microdosing. So it's very important to give the actual definition of what microdosing is. So microdosing refers to using smaller doses or inferior doses than the lowest commercially available dose. So with the FDA approved GLP-1s that we have, we cannot do microdosing. Why? Because the injectables come in pre-filled syringes. The vials come with single-use vials. And Wegovy pill, you can't split the pill because it won't work anymore. So microdosing is not something that we can do with Wegovy, Saxenda, Zepbound. We can't do microdosing. So microdosing typically is used with compound medications because those can be compounded at a different dose. The problem is that all the studies, all the data that we have, and we're talking about decades and decades of data of GLP-1, were not done with microdosing doses. They were done with the current doses that we have available. So of course, there's going to be concern whether these microdoses are going to be effective or not, or is there a benefit from patients actually doing microdosing? So we don't have any large studies or any convincing data that microdosing is actually effective for weight loss. And we can't really do it with the commercially available preparations of GLP-1s that we have currently.
All right. Okay. I think we got through a majority of the questions that you guys submitted, and we can open it up to our Q&A session. I actually can't see if any questions were were submitted. So maybe, I don't know, Dr. Gibson, can you see on your end to see if there are any questions that have been dropped into the question box? If not, maybe we can have like
No,
Jesse moderate for us a little bit here.
yeah, I think Jesse's going to raise a hand if there's any questions.
Hi, sorry, I'm coming. I'm in the office and I wanted to come to a quiet area. Um, okay, so first question is, what pills do you guys prescribe? Are they Wegovy pills? Pretty easy one.
Yes, we do prescribe Wegovy pills. Since it's been FDA approved now, it is available in commercial pharmacies and also through the cash pay option through the Wegovy pharmacy directly, and we do prescribe Wegovy pills.
Just to add on, just for clarification, are there other pills or is that the only type?
For weight loss management is the or like if the question is like if we use non-GLP weight loss pills, we
Are there
do.
other GLP weight loss pills?
No, Wegovy is the only FDA-approved weight loss pill out in the market. Rybelsus is oral semaglutide, but it's approved for type 2 diabetes, and the effectiveness of weight loss is quite inferior to Wegovy.
Okay, cool. And then a follow-up to that was, does insurance cover the Wegovy pill?
They do. If your insurance has their Wegovy pill in your formulary and you have an FDA approved criteria to take this medication, the FDA approved criteria is a BMI of 27 or above with weight related comorbidity like prediabetes, hypertension, hyperlipidemia, obstructive sleep apnea, metabolic associated steatohepatitis, which is fatty liver, if or a BMI above 30. If your insurance has this medication in their formulary and you meet the criteria, then yes, it is covered by the insurance. Now, every insurance is different. You might have a copay, you might have a deductible, but yes, they are covered by insurance if you
Okay,
meet
cool.
FDA criteria.
Yes. And if you work with Allara, we will help work with your insurance to figure out if you're covered, and your doctor will be able to
Yes,
help you figure out what the options are. Um,
great.
so the next one is, do GLP-1 medications affect your ability to gain muscle, especially since we lose so much weight while taking them?
I think that's a really good
Excellent question.
question. And so
Excellent question.
the, let's kind of talk about this because there is this idea out there that GLP-1s make you lose so much more muscle than just regular weight loss, which is not necessarily true. And so one thing I want to point out here is weight loss does not discriminate, meaning your body, you can't tell your body, I only want to lose abdominal fat, but not, my quads that I've been working on for the past 6 months. It doesn't work that way. When you are losing weight, your body loses weight kind of equally across all tissue types, whether it's muscle or fat, right? So, in order to ensure that you are retaining your muscle mass and losing weight in a very healthy, sustainable way, it's important to focus on protein intake, what your calories are when it comes to the amount of protein that you're taking in, and to focus on resistance training or some type of movement or exercise that's helping to retain that muscle mass. So, can you lose weight and keep your muscle mass for the most part? Yes, some of that is kind of called body recomposition, right? Where you're trying to lose more body fat rather than muscle mass. But generally speaking, being on a GLP-1, because they cause much more weight loss than someone who is trying to do it traditionally on their own, there is the perception that you're losing a lot of muscle mass, and that can be true. If in some cases, if you are not kind of going about it in the most appropriate manner, or if you don't have like the right type of nutrition support, it can happen. So you really do, it's just so important that you do find a care team that recognizes this so that you're not just getting a GLP through a doctor that's giving you a prescription every 3 to 6 months and saying, here you go, see you back in 6 months. That's not super helpful, right? So, in order to prevent some of these side effects from occurring, it's really, really important to make sure that your care team has just a good baseline understanding of these medications and know how to help you navigate this weight loss in a very healthy and sustainable manner.
Amazing. And also, if you don't know, we have dietitians and nutritionists on the platform who you can work with in tandem, who will work with your doctor. Okay, a lot of questions on hair loss. Is it inevitable? Can diet help? And is there anything you can do to prevent hair loss?
That's also a great question.
Also,
I can take this one, Dr. Gibson, if you don't mind.
yeah, absolutely. Go ahead.
So hair loss. Hair loss is a great question because we all want to keep our hair. I get it. It's so sad when the hair falls out. Um, so it really depends, actually. Some people who lose weight very rapidly, especially if you're losing weight too quickly on these medications because you're not really kind of focused on your overall caloric intake and making sure that you're retaining like muscle mass, things like that, then yes, hair loss can occur. It doesn't occur very commonly. It's only around about 5 to 10% total of people who are on these medications, but it certainly does happen more often if you're losing weight too quickly. And why is that? It's actually because the body recognizes that rapid weight loss as like a shock to the system. And so because of that, the hair falls out. Now, the good news is that it does recover It comes back. You don't lose it for forever. So it does come back in terms of the hair loss. But the question around like how do we prevent this hair loss from occurring or like reduce that potential? It's losing weight through a very sustainable manner, meaning your weight loss velocity doesn't go too high, meaning the rate at which you're losing weight isn't crazy. What do I mean by that? So, generally speaking, what we want to aim for is about a half a pound to about 2 pounds per week. So, really, if you're losing more than 10 pounds a month, like that's a lot. That's a lot of weight you're losing very, very quickly. And we want to avoid that because that certainly can set off the hair loss. Now, to help recover the hair, you can always do things like topical minoxidil to help with hair regrowth. Make sure that you are keeping your scalp clean. Scalp health is really important for hair growth as well. Decreasing any type of tension on the hair. So if you normally wear your hair in a really tight bun all the time, like that type of tension can worsen the hair loss. So there are things that you can do, but the most important thing actually is to make sure that you're losing weight in a healthy manner.
Awesome. Also, just to say, we've gotten a bunch of questions about specific if you're a candidate or not. I will send you a link if you want to sign up and book a visit, but we can't answer specifics about your specific condition and situation. Okay, let's see what else. Are there any key side effects that you should have top of mind while taking a GLP-1 because they could be indicating serious or longer term harm?
Yes. Yes. So when we talk about side effects of GLP-1s, we talk about common side effects and rare side effects. So common side effects, like I mentioned before, typically are short-lived, tolerable, mild, so we're talking about nausea, diarrhea, constipation, acid reflux, those type of things, hair loss, those tend to be side effects that we can probably live with. They do get better as you get used to the medication. And then we talk about rare side effects that could potentially be more serious. So one of them is a condition called pancreatitis. So GLP-1s need a healthy pancreas in order to work. And there have been some cases, even though the recent data shows that there is no direct link between GLP-1s and pancreatitis, but there is some caution because pancreatitis can develop. So pancreatitis is quite severe. It's not just stomach upset, it's severe pain in the abdomen, typically in the epigastric, like in the central part of the abdomen, radiating to the back. Patients are quite sick. It's not like, oh, I have a little bit of indigestion. That's not pancreatitis. Pancreatitis is a medical emergency. There has been some link with GLP-1 use and gallbladder disease. So patients who have active gallbladder disease should probably not be taking GLP-1s. Patients who don't have a gallbladder really don't need to worry. There are some questions like, oh, I don't have a gallbladder. Can I take GLP-1? Yes, you can. But there has been a link between GLP-1s and gallbladder disease. As far as gastroparesis, again, very rare, but it is a potential side effect of GLP-1. Gastroparesis is a condition where your gut just kind of paralyzes. It doesn't move. So paresis means it's paralyzed essentially. This is actually one of the most, I would say, severe side effects. Very rare, but has been reported. So this is something that we always tell our patients. We've seen gastroparesis happen more in patients that are on very high dosages, patients who have underlying diabetic neuropathy. So those typically are more like risk factors than the population that we have, but it's important to be aware. And lastly, medullary thyroid cancer. So this is very important to understand. GLP-1s have not been linked to causing medullary thyroid cancer. What happened is when GLP-1s were still in the animal study phase, rodents, that's where the GLP-1s were initially studied, had elevations of a hormone called calcitonin. Calcitonin is actually a cancer marker for medullary thyroid cancer. Some of these rats developed it. We haven't extrapolated this data to humans. We haven't seen GLP-1s cause medullary thyroid cancer. However, even though these medications have been around for about 20 years, That's still not enough data for us to comfortably say that they don't have a strong link to medullary thyroid cancer. So if a patient has a personal or family history of medullary thyroid cancer, we don't recommend these medications. So essentially, those are the side effects that we need to look out for. Really educate patients what are the common side effects, what to expect, so that you're not alarmed if you're nauseous or if you're constipated or if you have diarrhea, and what side effects potentially could mean something more serious. So something pain should not be a common side effect of GLP-1. Um, Severe constipation could indicate gastroparesis. So those type of things are really important to educate patients to kind of distinguish, okay, this is expected. All right, this is not, I don't feel good. There must be something wrong. So super important to always have that communication with your healthcare provider.
Thank you. Um, okay, we have a ton more, and I know we're running close on time, so we're going to answer a few more. If you have more questions, feel free to shoot us an email or book a visit, and you can chat with one of these lovely doctors and speak about your specific cases. We have had more questions about specific, instances that we're not going to get into right now. But let's start with one of when do you know it's the right time to start on a GLP-1? And then there's also a few more about, what is a safe amount of weight to lose? And then can Allara prescribe the lower dose in maintenance for hormonal and inflammation benefits to lose like 5 to 10 pounds? And I feel like they all kind of go together, but we can break them up. I think the first one is when to know it's the right time to start a GLP-1.
I
Well,
can
I
take
guess
that
it
one.
depends. Yeah, what do you want? Do you want to go ahead and I think we'll have probably the same answer to this.
Yeah. Yeah, I really do think it depends on what are your goals, right? So, what are
Yeah.
your goals when it comes to managing your health, managing your weight? Do you have an underlying hormonal or metabolic condition that's really making it hard to achieve those goals? And maybe you've tried in the past to do it on your own through diet, through lifestyle, and you're really struggling, then that's kind of where you have to figure out like what is that next step for you? Is it a medication that you want to start on that you might have to be on long term? I say might because you may be able to taper off of it at some point. And how I guess like what is the degree of like dedication you want to have to managing your weight, right? So there's not going to be a great answer to this because it really just depends on your personal situation. It depends on if you're ready and willing to be on a medication for weight loss. So that's a very personal question, and I think that the best way to get this question answered for yourself, honestly, is to go come see one of our providers on our platform, not as a plug, but quite honestly, like they can help you decide, is it time for you to start? Do you have these underlying conditions that will make it hard for you to lose weight and manage your health? And what are you wanting to lose weight for? Do you have a specific health goal? Do you want to get pregnant? Um, the, there's a lot of context here that you really need to unravel with your provider. So this is a great way for you to kind of get to a provider and help you figure out that particular question yourself.
That was great. We're gonna do the next one because it has two thumbs up, so that means other people are interested in hearing it. What is a safe or ideal amount of weight to lose weekly so you don't have issues with excess skin?
Yeah, also a good question. So the weight loss velocity, as we call it, so like what is that weight loss range that we recommend that is safe that our dietitians generally try to stick within is around zero point 0.5 to 2 pounds per week. Now, it's quite a big range. And one thing that you have to remember is that weight can fluctuate on a day-to-day basis. It can fluctuate around the time of your period. You can have a lot of bloating, water retention. So generally speaking, yes, you can weigh yourself on a weekly basis, but we want to track trends over time. And what's important with these medications as well to understand is it's not an overnight thing, right? You really want to try to dedicate at least 3 to 6 months on these medications to really fully understand what is that weight loss trajectory going to look like for you. So the short answer is there is a range that we're looking for. We definitely don't want to go above 2 pounds per week on a consistent basis, but sometimes you might lose a little bit more one week and a little bit less the next week, right? So it really is average overall. What does that trend look like month to month, in order to help your body adjust in a safe manner without having some of those other not friendly benefits of, let's say, like the extra loose skin or maybe like the hair loss. But it also, with the loose skin, I just want to be clear that the loose skin also can be secondary to how much weight you're losing. Some people may lose 15 to 20 pounds on this medication. Some people lose 50 pounds on this medication. You're certainly going to have some excess skin if there is a substantial amount of weight loss associated with these medications. So, again, end goal makes a difference. How quickly you lose the weight makes a difference. So, all of this is, it's very individualized, to be quite honest.
Thank you. And then there's so many more, and I'm trying to type answers to these at the same time, so I apologize if I don't get to it. Um, so the last one is, can Allara prescribe the lower dose and maintenance for hormonal and inflammation benefits if I don't want to lose more than 5 to 10 pounds? I do feel like we touched on this, but I feel like it's important to note, if one of you guys want to kind of take this about and talk a little bit about microdosing really quick.
Yeah, so if the question is specifically about microdosing, no, we're currently not doing microdosing here in Alara. If the question is more, can I use the lowest dose just to lose 5 to 10 pounds? It really depends. I mean, it really depends what your underlying medical conditions are, what your underlying uh, BMI is. Do you qualify for the FDA, the criteria? Do you not qualify for the FDA criteria? Is there going to be a medical benefit? What exactly are we treating? Do you have prediabetes? Do you have, hypertension? Do you have insulin resistance? So we really want to determine exactly what will we be treating. Is it just, oh, I want to lose 5 to 10 pounds for, you know, I need to get married and I need to lose some weight, or is it because I have symptoms of hormonal inflammation, or et cetera, et cetera. So we really try to differentiate, will these medications really benefit you um, on the X amount of weight that you want to lose? Do you have something that will be able to treat and treat effectively so you feel better and not only lose the weight, but also feel better, treat that underlying hormonal or inflammatory condition that you're experiencing?
Two things I want to add to that as well is when you are losing less weight on these medications, what's actually important is what we talked about in terms of body comp, like recomp, and also like what is that fat mass to what is that like muscle mass percentage, right? So you're looking more at like recomping your body rather than look, I need to lose like 20 plus pounds or what have you. And the other thing to realize is that when it comes to tapering or being on lower dosages, there are many ways to actually be on the GLP. You may not need to be on it on a very regular basis. Every week you're taking the medication. Sometimes when people go into like a maintenance phase, they might take the medication at the lowest dose, maybe every 2 weeks or however long that, they're working with their provider to figure out what's best for them in that situation. So like when you're kind of looking at lower amounts of weight loss, we try to focus on what are the underlying issues that we're trying to manage for you, and two, can we do it safely and focus on your body composition rather than just numbers when it comes to weight management.
Sure.
Okay, amazing. There are a ton more. And one of the biggest ones is, how do GLP-1s kind of interact with other medications and supplements? I think that's something we can chat about. Maybe we'll do a part two and talk about how it interacts, or we can do it maybe in our broadcast channel on Instagram. So we will get to these at some point. We just don't have enough time today. We could be here for a few hours. So thank you guys so much. And if you are interested in booking a visit, you can do that to chat through any of these specific questions, because some of them are really great. They just are more specific to you. Um, Thank you, and we hope you enjoyed.
Thank you so much, guys.
Bye, everybody. Thank you.